Hi, today I'll be presenting on the comparison of transcranial focused ultrasound treatment planning using MR and CT images. The typical treatment planning workflow involves uploading images of the skull to the Insight Tech workstation, which is used to calculate phase corrections that are then applied to the transducer hardware during sonication. CT images are typically used. However, there are some downsides to the use of CT. One, it exposes patients to ionizing radiation. And two, errors can arise from registering the preoperative CT to the intraoperative MR. For some years now, MR has been proposed as an alternative to CT to overcome some of these downsides. And as such, it is the goal of this study to compare the use of MR and CT for treatment planning using the Insight Tech workstation, specifically for the 670 kilohertz head transducer. The experiment was performed on 3 ex vivo skulls. MR images were acquired with a 3D stachyspiral sequence in which 2 echo times were used. The first echo time still has bone signal, whereas in the second echo time, the bone signal has decayed. The subtraction image, A minus B, does a good job of delineating the bone. We can take this one step further and divide the subtraction image by the sum of A and B to highlight cortical bone contrast. And we'll call this MR simulated CT, MR sim CT for short. MR sim CT spans a range of 0 to 1, 0 denoting bone and 1 denoting 0 denoting water and 1 denoting bone. We can use this as a bone fraction multiplier and scale linearly to Hounsfield units, spanning a range of 0 to 2000. The joint histogram shows good agreement between MR sim CT and CT Hounsfield units. The experiment is set up to have the skulls secured in a skull holder, which is then secured to the head transducer. Images are uploaded to the Insight Tech workstation, registered to the transducer, and then phase corrections are calculated. These phase corrections are applied to the head transducer during sonication, and the focal spots are measured using a needle hydrophone mounted on a 3-axis positioner system. We can see that with no phase correction, the focal spot is defocused and displaced, but with hydrophone corrections, the focal spot is just refocused. Using CT and MR sim CT for phase corrections, we get refocusing of the focal spot with varying pressures and positions. What I've shown here are 2D slices from a larger 3D volume that was acquired. And for the 3D data, we can evaluate the focal spots with some quantitative metrics. As a reminder, these experiments were performed on 3 ex vivo skulls and evaluated for 2 targets. Let's start with the geometric focus. We can plot the intensity for these different phase corrections. The bars with lighter colors denote the intensity, the peak intensity of the focal spot. And the bars with darker colors show the intensity at the target. We can see that phase correction calculations using an MR binary mask, MR sim CT, and CT all perform similarly. And we can also see this for the positioning error and focal spot volume metrics. Steering 5 millimeters lateral of the geometric focus, we can see that using MR binary mask, the intensity at the focus is substantially reduced. However, MR sim CT and CT still perform similarly. Due to large variance across the 3 skulls, none of the methods were found to be statistically different. In conclusion, MR sim CT achieves bone-like contrast that preserves information exhibited by the CT. MR sim CT also performs similarly to CT when calculating Insight Tech phase corrections. This adds to existing evidence that MR is a promising alternative to CT and that it should continue to be pursued. In closing, I'd like to thank my collaborators, as well as my lab at Stanford, who have all made this study possible. I'd also like to thank my funding sources. Thank you.